This is Barbara Mosier, and Barbara just gave us a great talk here in our office today, which I was fascinating to hear about women's health care. Tell me a little bit about your backgrounds, because it was so fascinating. I want all of our viewers to hear what you had to say.
Thank you, Dr. Magaziner, for having me here. I've been an obstetrical nurse for 25 years, and I am currently a fertility care practitioner intern, and I am learning the Creighton Model FertilityCare System and NAPRO technology.
What does NAPRO technology mean?
NAPRO technology is a women's health science that works collaboratively with the women's procreative cycles, and it helps a woman detect the underlying cause for her infertility so that they can correct the underlying cause and facilitate a natural conception.
So we know that infertility has been rising in this country and at very high rates now. And so what are some of the main reasons we're seeing so much infertility here?
One of the main reasons is that the endocrine disruptors, which is has an impact on their progesterone, their estrogen, and the cervical mucus is a very big one, where if you have limited cervical mucus, you will have a miscarriage, you will have trouble conceiving, you might have an ectopic pregnancy, something like that.
Fascinating. So the slide behind us, tell us a little bit about what does that mean?
So basically, with the Creighton Model FertilityCare System, you have the woman chart her cycles, and by looking at the cycles, you can actually detect the underlying cause. If you see a limited mucus cycle, the patient is going to be at very high risk of having a miscarriage.
So many women now are going to a fertility specialist, but this is something, sounds like to me, that they can do from home prior to seeking a fertility specialist.
Yes.
Am I right?
Yes, that's often the case. I will see a patient who has had many specialists look at her, and they do all this types of testing, and they say there's nothing wrong. Yet she's had multiple miscarriages. We look at her chart and she's got a limited mucus cycle. So we know we can use mucus enhancers to help facilitate the mucus flow and facilitate a natural conception and a healthy pregnancy along the way.
And I think you showed a slide earlier
Yes.
that indicated that your conception rates are extremely high within about 6 months or so.
Yes, very high. Within 6 months, 98% of women who have normal fertility can conceive. With someone who has infertility and they're using the Creighton model and the NAPRO doctors, if they use NAPRO technology, they will have an up to 80% success rate of achieving a pregnancy.
It's fantastic. All right.
Yeah.
So how can people learn more about this?
So they can learn more about this by going to the Pope Paul Institute website, and they can look up fertility care practitioners, and they can also call your office and you can give them the brochures.
And so this is part of Creighton University out in Omaha, Nebraska.
They worked along with the Creighton University.
Fascinating. Okay. It's a great adjunct to women's health care. Anyone could really utilize this type of technologies from what you're saying.
Absolutely. It is safe, it's reliable, it's evidence-based, and insurance companies will cover if there's a surgery that needs to be done. It's all covered.
Great. Barbara, I appreciate it very much. Thank you for your time, and keep up the great work.
All right, thank you so much.